The president said if you like your doctor, if you like your plan, you can keep them. But the fact is a lot of people are going to be thrown into these public exchanges where they can't keep their doctors or their plans without having to pay a whole lot more money because they'll be out of network.
Chris, I agree we should have this debate, but we shouldn't connect it to a government shutdown. That's the fundamental disagreement between the two sides here. I mean, just for an example, on the Senate...
But let's talk about...
I'm going to answer your question.
I want you to answer my question because the fact is this goes into effect whether there's a shutdown or not.
Right. Well, I hope that we have to read the delay provision. The delay provision says everything that goes into effect beginning October 1 gets delayed for a year. Does that delay the exchanges? It will definitely delay.
But you're not going to pass that.
It will definitely. You're right, but it would definitely delay the ability of people not to be turned away for pre-existing conditions. Delay maternity care.
Answer my question. What about people
you're right.
who
we are not going to pass it. We're not going to pass it because it is wrong to do a shutdown of government as the lever to make change.
But sir, answer my question.
Okay, now the question.
Well, the question is, the president promised you can keep your coverage, you can keep your doctor. No, you can't.
In the exchanges, the news that came out about the exchanges last week, and we're going to have to see on October 1st, is that people are going to have vastly more choices of insurance products and the ability to have them subsidized if the exchanges go into effect. This is.
But if I'm seeing Dr. Smith, and I like Dr. Smith, and I've seen Dr. Smith for 10 years, it may well be when I go into the exchange, I can't see Dr. Smith anymore.
I actually doubt that that's the case. The news about the exchanges is that the number of options is so great. You're going to have all kinds of choices, Dr. Smith or others that you might want to see based upon the reports last week.
Well, the facts just don't back that up. The facts suggest that what we see is a lot of people losing access to their doctor, to health plans that have worked for them for many years. This law is a train wreck. It's been described as such by its author in the Senate. And we can't move forward with it. We can't simply allow this train wreck to happen. As difficult as it is to stop it, we can't allow it to happen. Okay. We've got to do everything we can to protect the American people from this law.
Forgive me. I'm trying to stop the rhetoric. I want to get to the specific points.
Let me tell you why it's not a train wreck.
I'm not asking about that. I'm asking about coverage. Now I want to ask about premiums. It's like herding cats here today.
We are senators. I mean,
well, I understand that. All right, the premiums people will have to pay. Here's what the president promised.
They said that these rates would come in real high and everybody's premiums would be sky high, and it turns out, lo and behold, actually, the prices came in lower than we expected, lower than I predicted.
But the reality is more complicated. While older folks may pay less, let's take the example of a 27-year-old non-smoker in Philadelphia who now pays $73 a month, and he will pay $195 a month under the cheapest Obamacare plan. Senator Lee, in addition to the fact that under some of these plans, which just came out this last week, people will pay higher premiums, they also are going to have big deductibles, as much as $5,000 a year.
Big deductibles, high premiums, and we're seeing their statistics for 27-year-olds. We see that even when you get up to 40-year-olds, in many parts of the country, people will be paying sometimes double what they have been paying currently. And this is not acceptable. We're seeing astronomical increases in health care premiums, and people simply can't afford that right now. We can't afford to put that on the American people, especially at a time when we're being told by the president that this law would make health care cheaper, that this law would make health care more fair, and it's having the opposite effect in both respects.
Senator, I want to show you a letter that Regents, Blue Cross Blue Shield, sent a 62-year-old couple in Chicago this last week. They run a small business. Actually, it's 2 weeks ago they sent it to them. It says, quote, under the Affordable Care Act, they must get a new policy that doubles their deductible to $5,000 each, raises the cost of an office visit to a specialist from $35 a visit to $100 a visit, and increases their premium. Again, that's not what the president promised.
Chris, I don't believe everything an insurance company says. I'm sure the insurance company says, well, this is because of the Affordable Care Act. These are the same guys who were kicking people off policies and turning people away from policies because they had pre-existing conditions.
So you're saying these folks, when they are told their deductible is going to go up, their premium is going to go up?
That might be true, but it may have nothing to do with the Affordable Care Act. The word that was out this week about the premiums in Virginia when these exchanges open will be very favorable to people. And some of the numbers you were quoting earlier didn't take into account the fact that there's subsidies subsidies involved as well. So if you are beneath a certain income level, whatever that premium is, it's going to be subsidized and dropped, so it's very affordable. Again, very important questions, but we shouldn't be wrapping these questions up with a threat of government shutdown. That's what's fundamentally wrong about this debate.
I understand that, sir, and the shutdown is a different issue, and we've talked about that. I want to talk about Obamacare.
I'm going to keep bringing it back because there's only one side that is linking Obamacare with the shutdown of government. On our side, we say, let's have the debate. Let's have the debate about immigration reform, other important, but let's not wrap it up with a government shutdown.
I think you've made that